Good evening and welcome to the last session of day one of the third Diagnostic Leadership Summit. For the last panel discussion on the role, scope, and opportunities in lab automation market for enhancing diagnostic operations management, we have with us sharing their expert views a number of industry thought leaders. To begin with, we have Sukrut Joban Putra. I hope I've taken the name right, sir. Mr. Sukrut
Yes.
Joban Putra, he's the CEO and Executive Director, Lab Assure. We have Dr. Sajana Dutt, Director, Molecular Biology and Cytogenetics, Pathkind Diagnostics Limited. We have Dr. Geeta Chopra, Chief of Labs and Technical Operations North, SBU, Metropolis Healthcare Limited. Welcome. Mr. Indranil Roy Chaudhary, the Chief Operating Officer, Apex Kidney Care Private Limited, who will be moderating this session. Dr. Leena, I am unable to pronounce your last name, ma'am, sorry. The Head of Labs, SCG Hospital, Pan India. And Dr. Shelly Mahajan, Lab Director and Clinical Head Genomics, Caring DX Lab Director and Pathologist, Mahajan Diagnostic, Mahajan Imaging. Good evening, ma'am. Good evening and welcome to all the panelists. Over to you, Dr. Roy Chaudhary, for the discussions.
Thank you, Garima. First of all, I'm not a doctor, so let me clarify that right at the
Apologies.
beginning. I'm lucky and happy to be here in the company of all these accomplished people from the industry. Anyway, so thanks a ton to Garima and thanks a ton to Elets for organizing this. It's indeed a privilege and an honor. This is, I think, the second or the third time I'm participating in this. We have our esteemed panelists today, and the topic, role and scope and opportunities in lab automation market for enhancing diagnostic operations management and expert views. So when we talk about automation, basically automation means it is exercising control without interference, as simple as that. So in the last few years, we have seen significant automation in the industry. COVID has helped it. We have seen automation not only in performing tests, but also in logistics, also in accession, as well as in reporting, especially the ICMR reporting and the updation in the government portals and all. Now, obviously, there are multiple advantages of automation. All of us knows. I'll just touch upon them and then our panelists will go into those topics. So obviously it is reducing errors, increasing productivity, decreasing the turnaround time, safer working conditions, customizable lab information systems for organizations, and cost reduction in the long run. Well, that's a topic we can discuss because it's basically for the people who run the P&L, it is capex versus opex always on the lab automation front. So without wasting too much of time, I would straight away like to go to today's questions. And the first point which we would like to discuss is what has been the role of automation that the industry has seen during COVID times. I would request Sukrut to share his views on this. Over to you, Sukrut.
Hi, thank you, Mr. Chaudhary. As we all know, COVID has been a kind of a turning point for the industry in various ways. And uh, before COVID, molecular biology was a very esoteric, very specialized subject practiced at some few labs across the country. And during COVID today, I think RT-PCR has become a household name and word. Everyone knows about RT-PCR tests. So COVID was a time when, I mean, it's still going on. So, but during the first and second wave, there was a humongous amount of load which came across in all the labs. And I don't think we would have survived these waves without automation. So automation was an extremely important and welcome step. Technology came to our help in various ways. Of course, automation has always been around in lab information systems. So that part was anyway automated. A lot of biochemistry, immunoassays have been automated. But when it came to molecular biology, there weren't earlier there weren't enough volumes in all the labs to justify automation. But during the COVID times, there was enough volume, which created the need for automation to be there. And we've seen automation come into right from nucleic acid extractions all the way to amplification. So there have been variety of models from desktop kind of simple extractors to like a big machine with where you just put a sample and few hours down the line you have a molecular report. So, so automation was a necessity at that point in time, and it has helped us manage a lot of volumes. But at the same time, automation is also required, or it becomes viable when you have more volumes. So when post COVID, when the volumes are fewer, or I would say even non-COVID assays where the volumes aren't very high, automation becomes more challenging, more expensive. So it's a kind of a mix that you got to run in your lab. Obviously, there are variety of labs. They've got large setups, multi-center setups, two smaller independent labs. So each one will have their own model. But the fact is that today we have a technology which has now become available. It is tried and tested, and there are a lot of options available in that. So when it comes to molecular biology, I think automation has everyone has tasted automation to some or the other extent, and it's here to stay. Now, how far it goes to, how much of robotics we are able to bring in is something which only time will tell. Only future volumes are going to drive. But yes, I think it's we couldn't have survived COVID without automation.
So thanks, Sukrut, for that view. And since you raised and we started with COVID, let me straight away go to Dr. Sarjana, because cytogenetics and molecular diagnostics is something that we all talk about as the future, the way that things will go. So, Dr. Sarjana, what is your view, the role of automation in cytogenetics and molecular diagnostics? Over to you,
Right.
Dr. Sarjana.
Thank you so much. As Mr. Sukrut beautifully elaborated, automation really saved the day, and in fact continues to do so as the pandemic rages on. If I was to talk numbers, a back of the envelope calculation shows that a very basic non-automated COVID laboratory, which is just equipped, let's say, with one BSL-2, a centrifuge, and a couple of thermal cyclers, the maximum output in a 8-hour work shift that you can expect from such a lab would be something to the tune of 250 to 270 cases, which works out to something like 700 to max 800 samples processed in a 24-hour workday. And even for doing this, the kind of manpower that you would require is at least 7 to 9 basic technicians and 3 senior technicians. Now, if we compare this to a lab which has successfully brought in automation, and if I was to take our own example, during the peak of the second wave, Pathkind Laboratories was processing something like 12 to 14,000 samples per day. And we were able to achieve all this with a very, very lean workforce of under 25 people on the workbench. And this surely, surely would not have been possible without automation. Uh, However, the requirements of automation in a molecular biology setup in a non-pandemic situation are going to be very different. In those circumstances, the molecular lab would be processing a variable number of assays with a large number of analytes. So, a large number of assays and probably a handful of samples of each. So, the ask of a molecular lab in that situation would be towards an automation that surely improves speed and functioning and surely has streamlined workflows with minimal manual intervention. But along with that, it should not be dependent upon batch processing, which the automation till now primarily has been. So it should allow random access. It should be amenable to work with a lot of different sample types, different matrices. It should be capable of simultaneously running different kind of assays on the same bench, on the same platform, so that we do not have to have multiple different platforms for multiple different tests. And along with all this, it would really be great if we could have a platform which did not require, putting in the reagents and pulling out reagents after each run. And if the storage could be at room temperature, then wow, nothing like it. So, really, from a molecular biology perspective, that would be the wish list. Now, the question is that do we already have platforms like these available? I do know of at least a couple of them, but the bigger question is that how many laboratories would be able to successfully bring them on board, and much more than that, successfully utilize them with a successful ROI? So, those are really the more pertinent questions. And we all do know that the Indian diagnostic industry, it's working in a very, very increasingly lean and competitive environment. And over the years, many labs have already developed the know-how to successfully implement LDTs or lab developed tests. Now, in that sort of an environment, to have automation come in and successfully make its place would really require that the automated platform providers should be able to offer it to us at a workable cost. So that is going to be one of the very, very important and pertinent questions from my perspective. Similar examples one could take for cytogenetics as well. Cytogenetics traditionally it has been a very, very manual process, and takes a long time. So anything that goes towards number one, increasing the report quality, bringing out better TAT, uh, decreasing our dependence on the skilled labor, which is very hard to come by, especially in the field of cytogenetics. So all these things are something that one looks forward to. And again, there are a couple of, in fact, in the field of cytogenetics, I would say only a couple of service providers which have been able to successfully bring in automation through the process. Now, there are many providers which do have the analysis softwares, the image analysis softwares available, but through the process of bringing in, let's say, the harvester and etc., are very few. So again, the crunch point really comes to the available, not only the availability but also the pricing.
So
So
that's the
that's
key.
what I would
That's
say.
the key. The
Yeah.
availability and also the pricing. So yeah, fair enough. Very valid points made. Dr. Sarjana did touch upon, and Sukrut also touch upon how it improved the time in which the report is being given out. So Dr. Chopra, I'll come to you straight away, ma'am, with your vast experience. Where do you see the role of automation and TAT, the turnaround time? Because at the end of the day, the consumer is concerned with that. So over to you, Dr. Chopra.
Yeah, thank you. So basically, for long, many years, we were saying TAT. What is TAT? Sample kab aaya and when did we release the report? So finally, that is not TAT as we all understand. So the TAT is to report to the client, to the patient, to the hospital, to the end user. So in that, so that is first the definition should be clear to us, and obviously then why do we do? If we give a better TAT, obviously you have a better workload, you have growth potential, everything is there. So I would start with, so we have three phases basically, as we have in any other operations thing: pre-analytical, analytical, and post-analytical. So I would say that pre-analytical constitutes almost 60 to 70% of the is responsible for the TAT. So pre-analytical would not even means the logistics, client, and as well as till the sample from the sample reception reaches the to the equipment. So if we consider, so what all can we do? So for example, the clients we should or the and all the smaller labs which are attached to it. So we should give them facility to do online registrations, barcoding, and then send the samples. So have the if the samples come like that, it is easier for the reception to just create a batch sheet and centrifuge the samples into the lab. Then the other important thing is logistics. What do we do with the logistics? So it is easier for the smaller labs to manage all this, but the bigger labs, and especially the chain of labs, it's a real challenge. Not It is a challenge, but it has a lot of opportunities to do work. For example, if we start with that, so there should be a tracking mechanism. So we have already devised apps which really can track. So when the sample was collected, where is it, how, what is, so the whole tracking mechanism can be done. So where is it picked up, reaching, all that. And then of course, it is important if you are getting the samples from outside locations. So it is important sometimes to review the things. So if you have the data, so that means there should be a dashboard. There should be everything should be there in front of you for evaluation, analysis, time to time evaluation. For example, if I getting samples from Punjab, it is reaching 8 a.m. and I might try to get it 6 a.m. So this was obviously give me a better diet. Sometimes it is very interesting that sometimes you try to give to a bigger courier companies, but whereas smaller courier companies may give you a better diet because they might have lesser commitments, and that would become also cost effective to us. So that is the very important thing which we can emphasize on. And then, of course, errors would be less if there's registration, barcoding is already done. So that would bring us to the next phase, sample reception phase. So if you come to the sample reception area, so obviously it would be, if the lab volume allows, you might have sorters, so which can sort the samples and give it to the different departments. If the lab does not permit the size sorters, then maybe we can design the labs like that, maybe serum based assays on one floor and EDTA based, and similarly other fluid based, that can also be planned out. So coming from that to, if you come to the analytical phase, so we have nowadays big labs have bidirectional interface and everything, so that's not a problem, and the machines are quite quick. But the two important things could be that, if, for example, if we have a middleware driven systems, so that software will that will program so many things, that will do auto QC, auto calibration, and it will plan everything. Auto verifications can also be done. The other important thing which can be done is, the COLs, the chief of labs, can, with sufficient experience, they can actually plan auto authorizations, which NABL is also allowing. So you just have to give the data and you have to justify things. So a lot of based on what analyte you're wanting to auto authorize, based on AMR linearity. If you carefully plan things, then that is a big game changer. So you not only you're giving faster TAT, but you are maybe you need less number of doctors. Even if you have good enough doctors, which is also a requirement, they might not waste time on just authorizing or clicking. They might they might utilize their times in analysis, so many other things, QC, planning, talking to the clients, doctors, and planning things. So another thing which we could do is digitalize the TRF scanning in the pre-analytical part, which also will help. So that way we can do so many things. So, and coming to the post analytical, of course, it is easier. So we should try to match auto uploads, auto email rather than hard copies going. So I think these all. The most important thing is visibility of things, dashboards, and then evaluation of things. Of course, you can have apps to tracking the logistics, and apps for doctors on right away on their phones for authorizations. So that can all be planned nowadays. So this is all we can do. So if the time permits, then I can talk a little about digital pathology also. What happens is, so Metropolis was one of the first to start digital pathology. So they can be, they could be different models. So of course you have a central processing unit, and then you have digital scanners, and then everybody can do. So this is not only, it has several advantages. So you can do a centralized processing, so you need not have many units. Like for example, if I have 25 labs in North, I need not, put 25 histo units for processing. So the samples reach one place and do a central processing, and then going back slides also doesn't make sense. So you scan the slides. So in the beginning, when I started histo reporting, I was also very apprehensive. But now we have exposure, and it is so beautifully scanned, and you can, view a different uh, high power and magnifications. So that all really permits. So it is not only, faster reporting, but it may be doctor satisfaction. Sitting at the periphery, doctors, everybody wants to report, so that can be taken care of. And then of course opinions can be taken. So it is a one time investment, but of course the patient can be really benefited by that.
Yeah,
So I think that.
what I will only add to that is, Dr. Geeta, I had, in one of my earlier assignments, we worked with one of the topmost histopathologists of the country who gets a lot of second opinion. So their automation was used basically, to aliquot the samples, and the labeling system was automated so that, later on it can be used for any references and for any research work. So that really helps.
Yeah.
So thanks ton to you, Dr. Chopra, for that. Now, some of you touched upon automation in reducing errors, pre-analytical and then subsequent. Dr. Shelley, over to you to share your views on that.
Yeah, thanks, Mr. Chaudhary. This is a very, important. It's a very basic thing, but it's a very important thing when it comes to the whole lab diagnosis thing, because we as lab people or lab personnel, we are at a position in the whole of healthcare ecosystem where we we are the most, as lab we are the most currently the most automated healthcare field, if I could say. And also we are at a juncture where we sort of interact with all other fields, and they are dependent on the diagnosis of the report released by us for certain clinical decisions. So that pressure, I think, the pressure of giving out a good quality report in the best turnaround time at the lowest cost, that is something which forces us even more to bring in automation. uh, and why and how it should help in reducing errors. So what kind of errors are we talking about? The errors, we as laymen we would say manual errors, right? So there, as I think somebody just mentioned, the three phases of diagnostics is pre-analytical, analytical, and post-analytical. And the data suggests that approximately 70% of lab errors happen in the pre-analytical phase. Now, why should that be? Like if I talk about the journey of a sample when it comes to us, it starts with ordering of a test, then collection of the sample, transportation of the sample, labeling of the sample, filling of the TRF, the correct patient details, then entering the test details in the system, in the LIS system. All of this uh, is it's kind of a monotonous cycle where, like for example, if I'm reporting, there's a lot of science involved in it, and I know that okay, this may be a wrong thing, so I can correct it. But when I'm just going and asking the patient name, right, it's a very manual procedure, and that is why it's prone to errors. And that is where, wherever there are errors, there is a potential of improvement, there is a potential of quality improvement, right? So uh, yeah, so that's where automation comes in to help us in reducing such errors. So for example, and we it's nothing new, right? We have been barcoding the samples since, I think, years now. The LIS systems are much more advanced than they were some 15 years back. There is automatic interfacing between the machine and LIS system. There are automated sorters wherein the sample, if a patient has 4 samples, we can easily sort them out into whether it goes to biochemistry, whether it goes to which test is to be done for which on which sample. There are automated TRF scanners. So all of this helps us in using our highly skilled personnel, which, as Dr. Sajna rightly said, is hard to find, right? So we can save them from those monotonous repetitive tasks of, even if it's just as simple as something as like pipetting or capping and decapping. So these are very monotonous. This is a very monotonous work wherein the chances of error is also higher. So, I feel that that is where automation, whether the workload is slightly less or slightly more, it is something which has proven to reduce those errors to a huge extent. and. And I think there is a scope for even more to do. Like in our routine practice, we realize that that the sample is when the sample is being transported, we are in a city where there are traffic jams. So when the sample is reaching my lab, is it hemolyzed, or is the temperature right? If it's not right, at what point did the temperature go high? So now there are automated chips in the transport box, where it sort of gives an alarm whenever the temperature is not as expected. So so I think there is a lot going on, and there's a whole lot of scope to even make it even more automated. And then after the analysis part, in the post analytics part, there is automated verifications of reports now. There is delta check technology. Then there for to reducing those errors of reporting as well. So I think there is a lot which is being done. We are already very advanced in as when it comes to automation in laboratories, and I think there is a scope for even more. So yeah.
So thanks, Dr. Shelley, for that. I think we are continuously hearing the need, the necessity of automation across industry. Over to you, Dr. Leena. Would you like to highlight the new developments and the probability of the scalability part of it? So over to you, Dr. Leena.
Yeah, thanks, Indranil. I think we are having a really good discussion from the all the industry experts about automation. So I will be talking about. To start off with, what we have to see is, the question of scalability and the application, etc., cannot be answered without talking about a little bit about the market of lab automation. So as we all know, lab automation is here to stay, and definitely we all have seen how much it has benefited all of us in different ways. So if you see the automation market globally, the growth in in this division is about, as per reports which I was reading recently, it's about 7% compounded CAGR. So basically, how does this come about? Now all of us have understood due to COVID that automation has played a really important role. But what are the factors which is going to influence this division is another important thing which we need to understand. So basically, if you see, as with any other industry, there are certain growth drivers, and that is because there is a lot of investment happening in the R&D segment. And Healthcare industry also has become highly regulated. We are more and more into accreditation, and we are going for stringent regulatory control. Our error tolerance has become lesser and lesser, and even the patient has become more savvy, so they don't want to have any kind of an error. Like previously we could say that, okay, we had this problem or that problem, and which is why your sample has given this kind of a report, but nowadays the patient will never tolerate it anymore. So that is one of the drivers which is going to drive automation industry. And the opportunities here is that we have a huge improved healthcare infrastructure, especially in India. So all of, as we know, even the government has been investing in healthcare thanks to our lessons learned in COVID and during COVID. And of course, the private has always been investing more and more in healthcare. Plus, we have the pharma industry which is growing, and then we have AI, we've got analytical tools. All these things are going to drive this market. So when we talk of automation, we also these are the opportunities which I see over a period of time. But of course, having said that, there are certain restraints and there are certain challenges. So as said, like small and medium sized laboratories would definitely have a slower adoption rate of automation, and the workflow implementation, especially because the labs are constantly working, so the gestation period for that implementation would take some time. And also there are challenges because everyone is not technologically savvy, so we still have a long way to go where everybody, all of us can say that, okay, I can also operate this. And there are regional differences, there are city wise differences of how technologically savvy we all are. So these are the challenges which I think we have to see about the automation. Now coming to the various how smaller labs, or let us say medium sized labs who have tight budgets, how are they going to implement this automation? We cannot we can look at it in two different ways. So one is that there are automated workstations, there are automated which are actually modular types, and also there are integrated ones. So then we have robotic systems, then we have software and automated storage and retrieval systems, as one of the panelists was mentioning. So these are the certain things which can be automated. Now what do small medium sized labs do? Obviously they have to have efficiency. We cannot tell them that, oh, I'm a medium sized lab, so I'm not going to automate. That's not how it's going to be, because automation is the future. So we can scale this up by having certain things like efficient usage of the laboratory resources. For example, if medium sized labs focuses on trying to reduce wastage, trying to reduce the vacuum usage, to give a small example, or vacuum usage, or kind of trying to deploy resources at optimal utilization, then you can save on certain wastage kind of pathways which are non value added, and we can focus more and more on automation. Then also from the IT part of it, instead of having hard drives, instead of having disks and those kind of things which require, or local servers which require a lot of space, you can opt for a cloud based software. So you can have a cloud based technology which actually really and from my experience also, I have seen it really reduces a lot of your storage space and a lot of our what you call the cost and all these issues. For example, at HCG, what I've seen is we have a lot of data of genomics and histopathology, because obviously being a cancer care center, there are huge numbers of histopath which comes, and the Bangalore lab is also digitally equipped with digital histopathology. So there's a lot of data. So all this is now stored in a cloud based. So previously we would run around looking for local servers and ask the IT people to give us all computers and all, but now no longer. We have cloud based software. So these are certain things which we can do to scale it up. And coming to the another question is that, how are we going to what is going to drive the lab volumes? See, if you so that if you, as we all know, labs operate on volumes. So if you are going to focus on automation, if we have a vision of automating our labs, then we need to increase the volumes, otherwise it is not going to work out for sure. So what we have to do is, what is our focus market? Like for example, in India, which is an emerging economy, we have lot of geriatric population, we've got growing clinical cases, we've got evidence-based medicine. All these things are, we need to focus. So labs cannot work in isolation saying that, oh, I'm going to automate my lab, so I will only focus on automation. No, because as I think Indranil said in the beginning, that it's the PNL which counts. So you have to drive volumes on the other hand. So those things are going to drive the automation part of it, because we are going to focus more and more on health checkups, and then we are going to focus on molecular biology or any other division which is upcoming. And once you drive the volumes that way, then you can also focus on automation, because small labs can also take up things like robotic arms. You don't need to have a fully automated lab. You can just automate a part of it. You can have a robotic arm, and you can use it for liquid handling systems, which is useful in various divisions of the lab. And another new development, if you ask me, Indranil, what has happened, and to all the, I mean, I'm not going to take company names, of course, but there are various, all our major lab diagnostic companies have come up with various solutions for automating a lot of the lab redundant work, as we say. For example, there is one inventory management system which has started by a very leading lab diagnostics company. So this is, I mean, how many, all of us know that inventory management in the lab is something which is a really painful task, and it really takes up a lot of our time, and we don't even know where the stocks have gone, and it's kind of what has happened, how do we consume, how do we book the consumption and all that. So this is one of the things which has been automated, and this inventory management system just takes up so much of our workload. And it, at a glance, we can see that, okay, this lab is having this much of inventory stock, this much consumption, and it is all completely regulated at a central level. This is something new I have seen in automation. It has, I haven't, this is one of the good things. And also another part, another automation, a new development which I saw recently is the IT solution. IT solution, in the sense, the all the systems have been connected to a central software, and at from one central monitoring station, we can see the QC of each lab. We can see the instrument flags. We can see the Levy Jennings, and all sitting in one part. So if you have about 20-25 labs, you can even have a kind of a system which helps you to regulate it. So just imagine what all lab medicine is capable of, because if you are going to do the QC checks of all 25 labs, if you are able to see at one, I mean, I would be really excited about it. So these are some of the new things which have come up, and I think as lab people, the most important thing is to have a vision without going into saying that, okay, I will save this much of money or I will gain this much of money. It is important to align our labs to the growing IT needs, the growing technological developments. And so I'm sure if you have the vision, then obviously things fall in place. So we can say that, okay, I have saved this much of money on this operational things, and let's invest in automation. So that is how we are going to go forward. That's my take on this whole topic.
Yeah, thanks, Lena. I mean, all of us have been talking on this automation. So there's no doubt that automation is a necessity. But the critical part is we should all remember that out of an estimated 60,000 or 65,000 crore diagnostic turnover in the country, and of course, when I mention this figure, this is not a registered figure because we don't have the whole industry being tracked. So out of that, let's remember and let's understand about 10% only is in the regulated market. 10% is only with organized players. The balance 90% are in a fragmented, decomposed market. The government does not have even the clear guidelines for quality assurance. So in such a industry, in such a decomposed market, how will be automation taken up by, I would not even say medium sized, I would say the smaller labs, at least the labs which have got 100 crore or more turnover per annum, they may still, but those are also 23, 24 in number if you count them, and they only add up to 10% of the industry turnover. So I would now go to Dr. Sarjana for her views on cost versus benefit in this automation process. Over to you, Dr. Sarjana.
Thank you, Indraneel. Cost versus benefit is really what it all comes down to, doesn't it? So let me refer back to how really automation helped us during the pandemic. Now, taking a very pragmatic approach, it tells us that many factors actually came together to make this not just a want or an ask, but a need, and thereafter a success story. So there was an increasing pressure of TAT that we were facing. There was shortage of skilled manpower. There was the price capping by the government. However, along with that, also there was the fact that it was just this very limited kind of test that one needed to perform. It was a limited analyte that needed to be tested, and hence that is something which is very, very amenable to automation. But over and above all these were the numbers. And it was really the numbers that ended up justifying the fact that even the small laboratory at the corner decided to go in for an automated extractor. So far so good till the time that the pandemic is there and we're getting in the numbers. There is usage of automation, but once these specific numbers go down, that is where really the crunch would come, that how many of these smaller labs really continue to use automation, or would they just fold over. However, when it comes to the bigger or the medium sized labs, since they have tasted and they have really had the time to, in a very, very practical manner, see the benefits that are coming out of automations at various levels. So, automation not only at the instrument level, but automation also at the software level. Automation to a very small extent, if I may say, the usage of artificial intelligence, which is slowly creeping in. So we have tasted all that, and I'm, as Dr. Leena also pointed out, I'm very, very sure that the uptake would be good. However, the question begs to be asked, that is automation required or even desirable in a given laboratory? That would really depend upon many factors. And each lab must do a thorough analysis of its own underlying requirements for the automation. Any unrealistic expectations or unclear understanding of what really that piece of automation can deliver would actually end up making things counterproductive. If I may quote from Bill Gates, he said, the first rule of any technology used in any organization is that automation applied to an efficient operation would magnify the efficiency. The second is that automation applied to an inefficient operation would magnify the inefficiency. So, what it really comes down to is that any laboratory, big or medium or small, really needs to look into their operations and strengthen that. And there are so many small tools available which we are using on a day-to-day basis. Do a very thorough mapping of the workflow and the timings. Use continuous improvement, use Lean Six Sigma, use adequate tech support, and then decide upon which kind of automation, what kind of platform would really be the answer to our given ask. And let's not forget, automation comes with its own limitations, with its own hidden costs, not really just about the one time payout. Most softwares, they come with a recurring cost, they require upgradation. So do so many platforms. So technology certainly does not come cheap. Hence, it makes sense to do a very, very thorough ROI analysis to justify the purchase. And in this, towards this, all stakeholders must be really a part of this workforce. So, not only the technical people, the lab people themselves, but the management and also the sales force, because they would ultimately, it would fall upon their shoulders to bring in the numbers. So everyone must remain in the loop to be very clear about what exactly the automation brings to the table. And because really nothing at all would be worse than having a beautiful piece of equipment or a beautiful piece of technology that remains underutilized. So that is my take. Automation, certainly it would help us bring down the turnaround time. It would go towards increasing efficiency. It would, decrease the error rate. It would probably go towards increasing the bench efficiency. The costs would reduce. However, only and only if we have done our workup and in very clear terms decided that which part of the work planning would benefit most from bringing in automation. So that's my take on it in very pragmatic and simple terms.
Very candid, Dr. Sajana. Thanks a ton for that. I think we are moving on time, and before we move on for a closing comment from each one of the panelists, I think we have got time for one more question. I will come to Sukrut. Uh, would you like to share what the regulators and the accreditation organizations feel about this? Sukrut, you need to unmute.
Yeah, yeah, sorry. Yeah, I believe the regulatory standards are pretty agnostic so far. I mean, they've been set in a very generic terms so that they can be applied to any kind of setup. So they are that way quite secular, I would say. And at the same time, there is provision to acknowledge and accept automation. However, I mean, sometimes I feel that automation creates a semblance of accuracy. And while, of course, you have a lot of data, you have a lot of visibility to control things in a high throughput setup, it also kind of compromises your flexibility to handle variability. So, what by that I mean that a lot of times you have a variety of sample types. Now, if I look at even a simple example of extractor, any sample variation would lead to less quantity or poor QC on the output side. Now, when you do manual operations, you have a lot more flexibility to handle these things. So, to that extent, as Dr. Sarjana was also saying that one needs a good balance to from a cost perspective. But I'm trying to say that in terms of quality as well, you need to kind of balance the automation versus the non-automation part. And many times the regulatory bodies are, for example, would they regulate automation? It will be the same way they would regulate any other reagent. You've got the CE marked, you've got ISO marked, which is fine. So the supplier or the creator would submit obviously the best and the most optimized versions to the regulator, which will get them the certificate. But when I go and buy an automation, implement it, everyone is claiming they're certified. But obviously, my experience as a user is not as standard and as optimized as the seller is promising. So I may pass on the regulatory tick marks, but ultimately, how I am able to leverage that technology to deliver good quality at a good cost is an internal matter. So, from a regulatory perspective, I don't see a problem at this point in time, but uh, we need, we just need to be cautious that just because you're automated doesn't make you better or easier or faster or cheaper.
Yeah, that's true. Everything that shines may not be the best, may not be gold. Anyway, so what I will now do is, I think each one of us have shared our views. Before we close, I will now come to each one of you for your closing remarks. Let me start with Dr. Chopra. Over to you, ma'am.
So yeah, so I think in any lab, quality and TAT are the two things which will drive business and give customer satisfaction. So obviously, if we have to do faster TAT, we have to do automation. So it will not only give us faster TAT, but it will give us satisfaction for the scientific team, doctors not doing the usual stuff, focus on more science rather than, just usual stuff. And of course, so the key to is to have some dashboards, MIS systems, and evaluation and analysis in there for implementation. So that should be a must for, yes.
Thanks, Dr. Chopra, for your comments. And Dr. Leena?
Yeah, sorry, I was muted. Yeah. So I think automation is here to stay. One point which may worry many people is the effect of automation on manpower, because this is something which we all feel afraid that will automation take away our jobs, and will automation make the job of the lab technologist redundant, because then that would be a problem. But what we have seen over the past few years and also going forward is automation doesn't take away jobs, but it creates a different type of a job, which and all of us need to be upgraded for that particular job. Like now we are all very technologically, we are connected with the virtual meetings and all that. So similarly, it is not that we are going to automation is not a threat. Basically, even AI and all, it cannot replace the human brain. But that is one point which I wanted to make, because many people feel that it's going to affect job, but it's not like that. And we have all known that. I mean, all of us are lab professionals. We have seen how automation has helped us. It actually in the long run creates better quality of jobs rather than making it redundant.
Thanks, Dr. Leena. Dr. Shelley, your comments, please.
Yeah, so I think all of us would unanimously agree that automation has been and is the thing for successful running of a lab, be it a small size lab, medium size, or large, to whatever extent we deem fit for our own goals and our own the kind of service which we are trying to provide. Uh, we are practicing in a world where there is this ever evolving need of providing the best of service along with the best of quality. We are practicing in a time where a critical report does not only mean a patient which is there in the ICU waiting for the report for the treatment to start. A critical report is anything. It can be just a preventive health check, because that's what our end users, our patients, our clinicians are used to now. A report in 2 hours, 3 hours, a report which is up to the mark with the best of quality standards, a report which is easily available on a WhatsApp or on a SMS. So we are living in that world. I think we are moving in the right direction to that extent. And also automation would definitely not mean that the current workforce that we have becomes redundant, because automation is there only to make their jobs easier, and so that our highly skilled technicians can be used for something. They can focus their energies on improving the analytics part of the job, rather than barcoding or rather than sorting. So yeah, I think there is a long way to go. Every potential aspect of the job where there is a potential of improving the quality, I think that's where the automation will come in tomorrow. And the good part is that from the senior most doctors to the junior most technicians, everyone is sort of tech savvy and always open to learning new technologies and accepting that. That said, the quality control of the automation procedures, the validation of the automation systems, that is something that we need to focus more on as clinicians, as lab people. How that automation affects my quality of reporting, how do I want it or not, the decision of whether or not I want that automation in my lab should be in the hands of maybe the lab head. It cannot just to provide a better tat. I mean, we cannot be ready to compromise, of course, on the standard of quality of reporting that we are doing. So those would be my closing comments, that we do welcome automation, but to an extent wherein my work is not affected.
Great. Thanks, Dr. Shelley. Dr. Sarjana, your comments.
Right. So, as a laboratorian, the way I look at automation is something which is actually empowering us to do our work way better in an easier manner, and which is really something which is, very, very welcome. And automation really, it comes in many shapes and forms. So having automated testing platform or equipment is just one part of it. But what is really empowering us are really the other tools, the softwares. In today's world, data really is the data and the information, the analytics is where really the money is going to be. The money is going to come from. Most of the big labs, they are sitting on a huge pile of data and information, which, because we did not have enough analytical tools and softwares, we were not able to do the data mining as efficiently. However, even that now can become a source of revenue, and thereby automation, not only through equipment, not only through softwares, but also through artificial intelligence, is really the way to go. And yes, as we've all agreed upon, the uptake of automation would really depend upon the requirements and the wherewith of each laboratory and each hospital as it exists. But certainly, that is the way to go.
Thanks, Dr. Sarjana. Sukrut, your closing comments.
Yeah, I think automation is here in a big way, and it's here to stay. And uh, I believe the technology is constantly evolving, so it's become a great leveler. It's kind of democratized, become secular. Till few years back, only larger labs could have afforded automation. But now there is a lot of miniaturization which has come into all sorts of equipments, that even smaller setups can do some or the other part of automation. How one uses the automation is where there's going to be a differentiator. How who's the man behind the machine, or the women behind the machine, and uh, how they're going to use, because I feel that a lot of automation is creating black boxes. There's some data going in, some data going coming out, and obviously there's garbage in, garbage out. There is what is going inside the machine is not known. And I think we are probably the generation which has seen the manual working, and we are also seeing automation. Another 5-10 years down the line, we will have people who've only seen the automated working, and their ability to manipulate a process, or manage a process by knowing the science is getting increasingly compromised. And that's my worry with a lot of new technicians, that they just know that how to operate a machine, they don't know the science behind it. So how we use this automation going forward is where we'll have to be careful that we are able to equip our organizations, our staff, to manage the breakdowns, manage scenarios where there's no automation availability. So
Great. So I think all of us discussed, there's no doubt about the points what we all spoke. I'm not going to repeat them. However, at the end, I'm just going to make two very important points, which I feel is very, very critical for this industry. And this is where we as industry thought leaders can influence the government. Point one is, while we talk about automated systems and machines, the government should seriously look at relaxing some of the import duties on such instruments. Many of these instruments are not made in our country and they cost a bomb. Of course, during COVID, there has been some late relaxations and all, but we all know how we fought on that. So the government really needs to look at those points. The second thing is, the country is with Ayushman Bharat and other schemes. There are multiple private public partnerships going on. In my current organization, we are engaged in 8 states with PPP providing renal hemodialysis to patients. Now, what I mean to say is, whether it is for diagnostics or any other allied healthcare industry, when an organization has automated systems, obviously I take it for granted that automation has been brought in considering all the factors that you all spoke about. So when there is automation, when there is a very high standard of quality, such organizations should be incentivized by the government while participating in government tenders. I mean, there has to be some clause which ensures, because what are we talking about? Automation and everything we are talking about to reduce stat, to improve quality. All that at the end of the day, the consumer should benefit. And if the government is really, if they are really interested to make it happen, they should look at these two. One, reduce the duty, which will ensure more and more automated systems coming in and more lab chains or even individual labs adopting it. And second, the labs which adopt should be incentivized at least in some way by the government so that there is some motivation for the industry to move forward. That's my take. And I would now hand it over to Garima. I think we are just about time, Garima. Over to you.
Dot on time, sir. Dot on time. Thank you so much.
No, the
I would like
thanks
to
is
thank
basically to all the panelists. I have not done anything other than saying thank you and over to you. So I would thank all the panelists for a brilliant contribution. Over to you.
absolutely, sir. Thanks to you for leading the panel, and of course to all the panelists for sharing your insights and for sparing your valuable time to be with us. And as a small token of gratitude, we would like to present certificates to all of you. Can we have them on screen, please? Thank you so much, Mr. Sukrut Jobanputra, for your time and your presence, and of course your thoughts at the third DLS. Dr. Sarjana Dutt, for your presence today evening. Dr. Geeta Chopra, thank you, ma'am, for taking out time to be with us and for sharing your thoughts. Mr. Chaudhary, for leading the panel and, of course, being a wonderful moderator. And Dr. Leena, thank you so much for your deep thoughts and your insights on this, valuable topic. Dr. Shelly Mahajan, thank you so much, ma'am, for being with us today evening. So it was wonderful hearing you all, and we look forward to, continued association with you. Thank you so much, all. Thank you.
Thank
Thanks,
you all.
Garima.
Thank you, my
Thank you, everybody.
co-panelists. Thank you,
Thank you,
Indranil.
everyone.
Thank you, Garima.
Thank you, ma'am.
Thank you, everyone.